The topic is kidney disease and hypertension among African Americans and other parts of the population. And we're talking to Dr. Faulkner from Meharry Medical College. Dr. Faulkner, what we'd like to do during the last segment is to give you an opportunity to give our audience some information relative to hypertension and some of the other things that you think that they ought to know in order that they might be able to perhaps assume responsibility for their own health.
Well, the main thing is keeping your blood pressure under control. 120/80 blood pressure seems to be the target that we would like to have every patient who has high blood pressure reach. Another thing is watch your diet, cut back on your salt, and most of all, exercise. Get your weight down, keep it down. But exercise seems to be a very good indicator of decreasing the risk of worsening high blood pressure and decreasing the risk of kidney disease.
And so there are some things that individuals can do if, now you mentioned this whole aspect of diet. What are some of the things that you would encourage those individuals to try to stay away from as much as possible?
Well, you know, salted pork is a main thing, bacon, ham, those things. Pork that's not salted is pretty good, like pork roast. We want you to stay away from a lot of things like potato chips, all those knickknacks that you like to eat before you go to bed. Those things have lots of salt in them. They're no good for you.
And so you would encourage people to sort of be careful in terms of not only what they eat, but their snacks as well.
Yes,
very good.
Yes.
Now, we talked about, I think, earlier about the prevalence of childhood obesity. Now, does that is that a problem in internal medicine? And if so, exactly what are some of the problems that we generally associate with childhood obesity that really occurs or shows up in what you're doing?
Well, childhood obesity is a major problem because children are getting bigger and bigger and bigger. And of course, by the time they reach an internal medicine age, which is 18 and older, we already have lots of problems we have to deal with. You know, they might have diabetes by the time they reach adulthood at 18. They might be having some heart problems at that time. Certainly, they might be having problems with asthma and so forth. So many problems can occur, and as well as high blood pressure, because you know that the bigger you are, the fatter you are, the more likelihood of your blood pressure becoming elevated. So it creates lots of problems. Obesity, arthritis is a major problem that people are having, back pain, knee pain. It's just a humongous problem that we're having with obesity these days.
And all of those are generally, you can generally associate all those with obesity.
Yes, you can.
And now, I would imagine that Meharry has a number of programs that people might become involved in that could sort of give them additional education in reference to what they have to do in order to deal with this as an issue.
Yes, they can call the Clinical Research Center at Meharry Medical College and see what's going on there, what studies have already been implemented, what studies are coming down the pike that deal with obesity, high blood pressure, and diabetes.
And so when you say, you talk about studies, I understand that there's what they call trials.
Yes.
And do you often have trials in terms of trying to deal with that, and perhaps there might be some of our audience, members of our audience, who might fit into some of these categories that might, you know, that you might talk to this morning?
We have lots of trials going on at Meharry Medical College. We have trials going on in internal medicine, trials going on in the OBGYN department, trials going on in family medicine, trials going on in nutrition. So yes, we were looking forward to people calling in, seeing what we have available, and if they are able to fit into one of the trials, to come on and join us. Myself, I have the SHARP study, which is the study of heart disease and looking at renal disease.
Now, what the SHARP study, explain that.
Well, it's a study looking at, SHARP is the study of hypertension and renal protection. And what it is, it's a study looking at patients who have hypertension with some renal disease and seeing if we can give them a lipid-lowering agent or an agent that absorbs lipids, a decreased absorption of lipids, I'm sorry, giving them that agent and seeing if their renal disease as well as prevention of heart disease occurs.
And you do need individuals to volunteer for such a trial? Or
Yes, yes, yes. We need people who volunteer, who can volunteer for that. And we'd like for them to call us at